we've designed an injection molded face mask that we're hoping can help folks. So it's a liquid silicone rubber mask, a material that can be sterilized through autoclaving, through Clorox wipes, or even through alcohol wipes. And it keeps and maintains those same material properties that we need for these masks. Not only that is that it can be reused, and we would hope from tens to hundreds of times, knowing that we're actually at a deficit or a dwindling supply of these face masks currently in the hospital. And a positive thing is that you can actually pop in and out these filters. So now it's popped in and then just taking it out. Once you injection mold a mask like this, it only costs, it could cost less than $1. There are a number of major properties, and one is that it's extremely flexible, so it can fit to a number of different face sizes and shapes. Two, we know that as you just mentioned, it's indestructible or almost indestructible, in that we can heat it up to really high temperatures to kill off the virus, and then also dip it into either a bleach solution or an alcohol solution to kill off the virus itself or any bacteria. Right now, the material itself, the filter material, is made out of N95 materials. These are all approved through the ASTM standards. And so for that itself, unfortunately, we don't have a huge supply of these N95s quite yet. And so we're looking at other potential materials that can be used as filters. And so here at the Koch Institute, there's a slew of folks that are working on this and trying to develop these new materials, testing their filter efficiency and see if they would be amenable to that for use in the hospital. I would love to be able to get this out to our cancer patients and our prostate cancer patients in particular, just because I know treatments themselves could be delayed or halted just because of what's ongoing right now. The major limiting factor is money, and trying to just because every iteration that we make on the mask itself costs about $18,000 to $20,000. I think if we were to, in about a week, I think we could be there in terms of the scalability. The fortunate thing is in terms of the system that we have, moving from the 3D printing, where you have a select number of materials, to the injection molding, is that it is hugely scalable. They can make this on hundreds of thousands. Once you injection mold a mask like this, it only costs, it could cost less than $1 if you're doing this in large quantity. And so you can have a reusable mask for $1 or less that can be reused from tens to hundreds of times. Now, the filters themselves could be, once they're cut out and applied, they could be on the orders of you're talking about cents probably. So this could be a much cheaper method to manufacturing and getting N95s out, as long as we're able to meet certainly all of the standards.